Hello, I'm Dr. Elizabeth Conn, and I'm just going to go through one of the key aspects of this course, which is understanding practice change and why we need to do it. So one of the things that you sort of need to start thinking about as you start looking at the assessment items for this course and reading through the modules is that you need to understand what's current practice in order to change it. And so to do that, you often need to do an audit. And this is actually assessment item 2, where you actually present your clinical audit. And one of the things that we're going to look at today is the difference between an audit and research and the links between an audit and research, because often they go together to really establish a need for practice change, what best practice is, and how you might change it. So first up is to explore the problem. And this is about identifying a problem in a practice area. Now we have another video from Sharon Latimer where she talks about the role of the registered nurse to really pick up the need for change. And so this may come from patient and staff surveys, may come from general feedback. It may, you may be looking at an area where there's a problem with staff mix or patient outcomes. There may have been complaints, or it may just be annual monitoring where you're looking at an audit to actually see what's happening. And this may be sort of aspects such as readmission rates for a particular disease or a particular condition. And so think about what's happening in your area and what audits are being done. And so when you're looking at a clinical audit, the first thing is, why does it need to happen? So this is often that need, because this helps you realize what sort of audit you actually need. We need to understand who's involved. So is it staff? Is it patients? Is it health professionals? Is it a visual audit that we're looking at maybe in theatre where we're looking at, completion of checklists? Or is it hand washing? Or is it something about wounds? So what are we looking at? What are the guidelines to follow? And then a systematic process of collecting that clinical data. One of the things you need to sort of understand is what actually is the definition. So a nursing audit is a process of collecting information from nursing reports or other documented evidence about patient care and assessing the quality for the purpose of quality assurance. So when you're looking at a practice change, it's about improving the quality of care provided. So we need to understand, the reason. If it's, quality and process and organization, we need to think about what the actual outcomes are, the process that we're going to take, and the structure. And so all of these help inform what you're going to be doing in assessment item 2, but also if you're going to undertake some clinical audit in your particular clinical area. One of the reasons why we do clinical audits is could be for accreditation. So we're looking at, best practice, that we're meeting best practice. It may be credentialing of staff. So you may be saying, we're looking at sort of that this ward is wanting to have that X number of staff are credentialed. And so we need to actually do an audit to see who is credentialed, what they've completed, and what that looks like. It may be for risk management. So when you're looking at falls, medication errors, that's definitely about risk. But it may be hand washing, infection control, pressure injuries, or maybe looking at research output that's been across different areas. When you're looking at an audit process, you need to define what you're actually looking at and the population, who's involved and the length of time. So is it going to be a snapshot or is it going to be an audit over 3 months, 6 months? Develop a clear plan, a timeline, and does it cost anything? So if you're looking at nursing staff observing a particular area, that will be a cost factor. If you're looking at sort of a past audit of charts, it's going to take time. And so then you need to sort of look at the collation and reporting and evaluation of this process so that it actually makes sense. It's not just a whole lot of data. So who's involved? Often when you're doing an audit, there'll be a key number of people. There may be staff which are actually doing the audit, collating and analysing, reporting. You also, if you're wanting it to be about changing, then you need to have the clinical staff involved, because then they develop this sense of, I'm understanding this and I want to be looking at improving practice. So you really want to look at that encouragement of involvement. We want to have truthfulness if more clinicians are involved. So, don't say it's going to take 5 minutes to fill out this audit if it's actually going to take 20 minutes. So you want to have that sort of understanding so they take part in your audit. A recognition of time and the value of the audit. So what is it going to actually provide? What's it going to change? And how does this influence their practice? Provide training. So if you're doing, say, an audit on wound care, you might need to have training on specific aspects and tools they're using. If you're looking at an audit on IV practice, so you may have a specific tool you want the staff to complete every time they put in an IV or they have a patient with an IV. And so this is about training. And make sure you have a good feedback loop so you can really follow up. Um, you may look at an audit as a retrospective view, and this is where we're looking at maybe sort of issues or quality concepts that we're going to look at with patient discharge. And so you're looking at, chart audits. And so you might look at sort of, has there been what sort of phone calls, follow up, patient discharge, what were they readmitted, how many dressings were done. So this is a whole lot of aspects we can look at in a chart audit. It really looks at sort of the quality of nursing care and what's provided in the record. So that's why it's very important that you actually documenting what you're doing, because this is often what's used to as the audit to establish that this is actually care that's been completed. A concurrent review is where you're actually still looking at the care while the patient, while the care is being taken. So this is, you're doing an audit on wound care or, patient IVs. It may be happening as a sort of pass where you're looking at, how many times a patient needed an IV reinsertion, how many times that the checklist was completed, or you may be doing it as concurrent review, which means that as the IVs are being put in, they're filling out the tools. Or it may be that you're actually looking in a operating theatre situation and you're looking concurrently at number of checks done and the process of those checks. It may be by the bedside or it may be interviewing. And so you may be looking at care plans on a regular basis to see what's being documented. So this is not retrospectively because the patient is still an inpatient. When we're looking at audit versus research, one of the things that is very clear is that an audit is not randomized. You choose your sample and that's who you look at. Where in research, there's often inclusion and exclusion criteria, and it may be randomized. And we're comparing actual performance against a standard, where in research you're normally underfying, sort of looking at, best approach, what's actually happening. And so it's important as you're going through at this module that you look at the information around audit and research. One of the things that's really important is when you're looking at results, that research can be generalized because you may have done it in a few areas or you may have a big enough sample, but an audit is really about that particular sample. And so it may not be able to be transferable unless you did several areas, which is then much more like research. And so the link between audit and research, they often are actually identifying what's happening. Research then identifies best practice, and then you can actually identify what could be changed and how to change it. And so that's why we're getting you in assessment item 2 to do your clinical audit. Thank you.